Good afternoon or good morning if you're in a time zone that is still morning. On behalf of the Centers for Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Support webinar series. My name is Anna Whiting-Sorrell, and I work for Kaufman and Associates, and I'll be your moderator today. Today's webinar is titled Vaccines for Wellness. Please note that the webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in the webinar are those of the presenter and do not necessarily represent the official department, the official position or policies of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. So with that, I'd like to introduce our presenter, Cami Emerson, who is a community health specialist at the WellWise Services Area Agency on Aging in South Central Michigan. Cami, I'm going to turn it over to you.
Thank you, Anna, for the warm welcome. I've been a community specialist here at WellWise Services Area Agency on Aging for about 3 years now. I have a bachelor's of science in public health from Wayne State University in Detroit, Michigan. It's a great place to go if you haven't been before. If we go to the next slide, I can discuss our webinar today. I will be describing our program in section, showcase our community partnership development, and detail funding mechanisms. So I will be talking about our Vaccines for Wellness program. This summer, we received an award from US Aging at their annual conference in Salt Lake City, Utah. Not sure if anyone was there, but it was for the Aging Achievement Award in the Public Health and Vaccination section of the awards. So just a little bit about the program. Our immunization efforts for COVID-19, flu, shingles, and more were designed to leverage new and existing partnerships with local health departments, health systems, pharmacy networks, and other human service agencies, and to improve equitable access to immunizations, particularly in rural areas where transportation is a barrier. Efforts include innovative collaborations, such as partnerships with local pharmacy networks to provide in-home vaccines and drive-through vaccine events. So today I'll be discussing this great program that we are very proud of. So who are we? We are WellWise Services Area Agency on Aging. It is a mouthful. We usually go by WellWise Services, but we were previously known as Region 2 Area Agency on Aging. Earlier this spring, we went through a rebrand and moved into this beautiful new building. It's right across the street from our old building, right in downtown Brooklyn, Michigan. So since we are an area agency on aging, we work to improve conditions affecting the lives of older adults with disabilities, and caregivers. We help identify concerns and develop a comprehensive and coordinated network of services to help our clients function as independently and safely as possible in their homes and communities. Next slide, please. So our service area, we serve 3 counties, Hillsdale, Jackson, and Lenawee counties in South Central Michigan. We border Ohio. Hillsdale is very rural. They have one main city in the center, and Lenawee is our next most rural, and then Jackson has a large town in the middle of it, but the outskirts of Jackson County are very rural as well. We have lots of farmland, lots of lakes, and then in Hillsdale, you'll see a lot of windmills. So I'm going to discuss how we started this program So in early 2021, as we all probably remember, the first COVID vaccine was released to the public, and this caused a lot of anxiety and stress among community members, along with health departments who were trying to get the vaccines out to the community. And so this graphic here is actually from one of our local health departments, Lenawee County Health Department, and they put this out to the public very early on, so that everyone was aware of the vaccination timeline, and they could find their specific phase. And then if you follow the green lines, you can see when you can expect to be vaccinated. So older adults and adults with disabilities were listed in the first few phases of the vaccine rollout. Throughout these phases, they mostly stayed on target with the dates of when, or the months of when people could get vaccinated. So that phase 1B was 75 years and over, that weren't included in phase 1A, which included long-term care residents. And then phase 1C included 65 years and older, and then also 16 through 64-year-olds who had COVID-19 risk factors or pre-existing conditions. So all three of our counties handled vaccine delivery very differently. In Lenawee County, the health department headed the task of vaccinating the community, and they picked one central location where they would have vaccine clinics, and that was at the local fairgrounds. They had the National Guard come in and give the vaccines, and then for their sign-up mechanism, that was an online platform that you could make an appointment. Jackson County, it was mostly the health departments who were taking on the role of vaccinating the community, but they also partnered with local pharmacies to give those vaccines, and they set up in transportation garages around the county. So here in Michigan, we have snow plows. So that's the snowplow barns is where they would vaccinate. So it was a drive-through vaccination site. And then they would also set up at local fire barns that had the drive-through capability. And they used the platform Sign Up Genius to schedule appointments. And then in Hillsdale County, their health department actually serves 3 counties, and only one of those counties is in our service area. So we had to work closely with them to target Hillsdale to be able to help. They also had the National Guard come in, and they utilized local high schools for their vaccine sites. So this picture here is actually from Lenawee County in their fairgrounds building. This was their mass vaccination site, and the National Guard was there giving those vaccines. So once the appointments were available to schedule for yourself, we as an agency had a few concerns about how our targeted population, older adults and adults with disabilities, were going to make those appointments. So our first concern was internet access. Since we serve a rural population, not everybody had access to the internet, and the only way to schedule an appointment was online. So that was our main concern. And then our second concern was the ability to use the internet. So maybe our target population has access to the internet, but they don't know how to navigate through the scheduling process. Maybe they don't have family or friends that can help them navigate through. So how are they going to sign up for a vaccine appointment? Our third concern was transportation. In the main cities in each of our 3 counties, they have local transportation, but they don't always go to the outskirts of the county. For example, in Lenawee County, if you want to be picked up outside of the main city of Adrian, there is a scheduled route. So maybe you're in Hudson, the bus would come at 7:30. would come through Hudson at 7:30, but your appointment's not until 2 o'clock that day. You would have to wait in Adrian until your scheduled appointment time and then wait for the bus route to then go back to Hudson, which might be around 5 o'clock. Our fourth concern was accessibility at vaccination sites. How far of a walk is it to the front door? Are there wheelchairs available if somebody needs assistance once they get to the door? What does the venue look like? So we wanted to get some eyes in the clinics to see how we could help. And then our fifth concern, which was a major concern for us, was what about individuals who have a hard time getting out of their home? How are they going to get vaccinated? Because at this time, the only option was to go to these mass vaccination sites. So with all of these concerns in mind, we started working closely with the local health departments in our 3 counties. And we were able to participate in some local emergency phone calls that allowed us the ability to advocate for older adults and adults with disabilities and voice our concerns. Then once we met with these health departments and listened on these phone calls, we gathered as an agency to discuss what we could do to help, to come up with a plan. And I will talk about that plan in later slides. But we offered this plan to the local health department partners and allowed for their input on what kind of help was needed, because at this time, everybody wanted to help and we wanted to make sure that our help was impactful for those that we serve. And after going to the health departments and them agreeing that they can use our help, we ended up gaining access to their scheduling software, and appointments were set aside for WellWise Services to fill. So we had a number of appointments each week that we were able to fill with community members who needed assistance doing that. So the first thing we did is we set up what we call vaccine hotlines. They are just a phone line that is a local number. A lot of people in our area don't trust outside numbers. Our local number here is 517-592. If it doesn't start with those 6 numbers, they're probably not answering the phone and they're not going to dial that number out. So we set up a hotline for each county, and the purpose was to serve community members who did not have access to the internet or know how to use a computer and didn't have someone to help them. So someone would call into the line and it would go straight to a voicemail. And on the voicemail, there would be a message that would ask them to leave their name, their first name and last name with the spelling of it, their date of birth, address, and phone number. And this allowed us to track the calls and to make sure that we had all of the needed information. We noticed when we first started this that people would call this call-in line multiple times a day to make sure that they were on the list. So we added in the voicemail, do not leave duplicate calls. If you leave a voicemail, you will be on the list and will be getting a phone call back. So then staff were assigned to each hotline. With all of these calls, our voicemail box could only hold about 70 calls before it would be full. And then we would have to go through and clear out the calls. And on some days, this voicemail would fill up 2 times a day. And sometimes those were duplicative calls. So staff were assigned each hotline to then pull the information requested off of the voicemails into an Excel spreadsheet. And this spreadsheet was shared among all of our staff so that we could all be working on this task together. Staff would then call the community members back to schedule appointments using the scheduling software for each health department. So this was a big deal that we had access to these appointment times. We were able to, get people the time and day that works best for them. Maybe they're a couple, they want to go together. We can set that up for them. And another important piece on these follow-up phone calls back to the person, we took the time to explain the process of what to do when you get to the vaccine clinic. Um, Most people were very anxious about going and they wanted to make sure that they were prepared. So, we'd walk them through from the moment they get to the parking lot, where the front door is. When you get in the front door, what identification are you going to need? You'll sign in so they know you're here for your scheduled appointment. Most of these places didn't want people coming in 5 minutes earlier than their scheduled appointment time. So we tell them to wait in their car until the 5 minutes before. They would then talk to them about going and filling out the consent form, what they can expect that to look like. Then they'll get called back for their vaccination. Then they'll wait for their 15 to 20 minutes after their vaccination. And we would reiterate that it's very important that you schedule your second dose appointment during that time frame, because at the time it was very hard to schedule a second dose appointment if you didn't schedule it during your first dose. So we would make sure that they felt comfortable with the process, they knew what the plan was, and if they had any questions, we could answer those. And we also went as far as getting turn-by-turn directions for people. Some of these people don't have GPS, or they've never been to the fairgrounds or to whatever location the vaccine clinic was being held at. So we would give them turn-by-turn directions over the phone, and they would take note of that. So once we started helping schedule these appointments, we were then asked to come help at the clinics. They needed some extra hands. And since they were going in, we thought this is a great opportunity to help with some of the concerns that we had with the clinics. So staff were sent to help complete consent forms for people who had difficulty reading or writing. This also goes for people who had high anxiety. These consent forms, they have big words on them. They may not make sense at the time that you're completing them. So we would sit with them and help them fill them out. I remember there was a question about, do you take any certain blood thinner medications, and it listed all of the medications. And instead of reading all those medications, we would just ask, do you take any blood thinners? And if it was a yes, then we would go through the medications. But that seemed to help a lot with, just trying to calm people down and make the process smoother. Staff would help schedule community members for their second dose appointment immediately after receiving the first dose. And with these appointments, it would send a reminder to an email address. But many of these people didn't have an email, or maybe they had one, but they don't log into their email. So we had appointment reminder cards created so that they could take them home. They can keep them with their vaccine card. They can hang them on their fridge. It's something that our targeted population is used to getting reminder cards. And then we also provided support for people while they were receiving the vaccine. So maybe someone just needs a hand to hold. I remember in the beginning, caregivers weren't allowed in to assist during the vaccination process. So we took that on to help in whatever way possible and to relieve any anxiety people had. So transportation in our area, like I had mentioned before, is a huge barrier. I know it is, seems to be in a lot of places. So we really had to work hard to think, how can we solve this problem? And at this time, there was still COVID, and some of the transportation services had strict guidelines. So we ended up receiving funding that could help pay for transportation to and from vaccine appointments. We still have that funding today. It's just a different source. But what we could do is we could schedule somebody's vaccine appointment, and then if they needed transportation, a community member was in need of transportation, they could utilize our vaccine hotlines, and we could set up and pay for the rides. We would also, if we did set up these rides, we would also call the person the day of and remind them, since we already paid for the transportation, it was important that they got into that ride. So we would call and remind them, hey, someone's coming to pick you up. Can you please be by the door, or can you be outside waiting for them? So this relieved some transportation barriers for those in our 3 counties. It wasn't utilized as much as we thought it would be, but we did provide multiple rides for people. Our next concern was, what about people who can't leave their home? So we have 2 main programs at our agency, and many, we call them participants if they're on our program. So many of the participants are mostly at home. You know, maybe they can get out every once in a while, but to go to a vaccine clinic and walk up to the front door and then go through the long fairgrounds building, it's just a lot on them. And so we worked hard to come up with a way that we could help those that are in their home. And the only thing we could think of was to offer in-home vaccinations. So we ended up contacting the pharmacy that was working with Jackson County Health Department. They were already administering the COVID vaccine. And so we reached out to them and asked, is this something that you would be interested in? Could we come up with a plan to, you know, reimburse you for time to this community member? And we're totally on board. They're a local family-owned pharmacy. I'll give them a shout out, Brown's Advanced Care Pharmacy. We created a memorandum of understanding that went over both of our terms. And after that was signed, we took off with promoting our new in-home vaccines. We offered them to our participants and our programs. So most of the vaccines were for older adults or adults with disabilities, but we did not require people to prove that they had a disability. They just had to identify that they had a disability. So if the pharmacy was going to the home to give a vaccine and they had a caregiver, a spouse, a roommate, or adult children that were already there in the home that hadn't been vaccinated yet, the pharmacy could then vaccinate. So maybe they're going out to give one vaccine, but they get to the home and, you know, there's 4 other people in there who haven't received their vaccine. The pharmacy could administer those. And we agreed to reimburse the pharmacy for their drive time, mileage, and vaccine administration. At the time, the reimbursement rate for the vaccine administration was $35 per vaccine administered. And the mileage was our state rate, which I think is around 61 cents per mile. So once we created this pharmacy partnership, we then partnered up with our local Department on Aging, health departments, and doctors' offices. I should also include our local Center for Independent Living to spread the word about this new service that is offered. And referrals could be sent via the vaccine hotlines that we already had set up, or we received word that it would be helpful to have an email. So we created 3 emails for our different counties. Just an example of one, we just did our county name, so lenaway.vaccine@wellwiseservices.org. And that way, doctors' offices and the departments on aging could just send a quick email with the information, and then we would follow up with the person. So like I said, once we received the referrals, a staff would call the community member to confirm the information that was sent. Again, name, date of birth, address, and phone number. And then we would explain the in-home vaccination process. So that would be walking them through, you know, what's going to happen. So the pharmacy is going to give you a call to schedule a time to come out to your home. It will be from Brown's Advanced Care Pharmacy. Usually it's a gentleman named John, but it could be, you know, another staff member that's helping out. Once they get there, you're going to fill out your consent form, and then you will get the vaccine. And then the pharmacist will wait there with you for the 20 minutes to make sure there's no side effects, and then he will leave. So just making them feel comfortable with someone coming into their home during this scary time where you're supposed to stay away from others. And most of the time, these people that are in their homes are more susceptible to getting COVID. So it was a lot of just reassuring that, the pharmacist is going to have the correct PPE on. He's a trustworthy person, and answering any other questions that they may have. So once we called and confirmed the information and explained the process, we then arranged so we kept all of this on an Excel spreadsheet. We then arranged all of the referrals by county so that the pharmacy could easily organize their plan on how they're going to get to all of these homes. We would send that Excel spreadsheet to the pharmacy with an encrypted email, and the pharmacy would then call to schedule the appointment. And then once they were finished with giving that vaccine, they would email us an invoice for reimbursement. And this we found was the best method, was to do it for a whole month. So they would hang on to all of the people that they vaccinated, and then let's just say for the month of November, they would then send us an invoice the first week of December. While we were doing these in-home vaccines, it came on our radar that HFAs and AFCs, which are home for the aged and adult foster cares, they were forgotten about when the vaccine was first rolled out. So a lot of the nursing homes were given the option to get these vaccines early, but these homes were forgotten about. So we received a list of all of the HFA and AFC homes in our region, and we split that list in half with our local Center for Independent Living and contacted all of the homes to see if they needed vaccines for their staff and residents. Most of the time when we called, it was the first time anyone had reached out to them to see if they were in need of this service for their residents. So if the home was interested in receiving some in-home vaccines from the pharmacy, we would then take that as a referral, like it's an in-home vaccine, and we would send that for referral to the pharmacy. Before the pharmacy would go out, I would go to these homes to deliver the consent forms so that they could be filled out before the pharmacy got there. This was important because some people in these homes have guardians, and the guardians needed to sign off on their consent form for them to get their vaccine. So once the pharmacy went out to do that, they would then reimburse us the same way that they would with individual and home vaccines. And we tracked the completion of the homes visited on a spreadsheet. And then whenever a new release of a vaccine, like a booster, or now they're calling it the updated COVID vaccine, when that's released, we call these homes to see, are you in need of the pharmacy to come out again, or can we schedule transportation for your residents to go to a clinic site? So this has been really great in creating partnerships and relationships with these homes, and making sure that everyone that is in need for a vaccine is able to get one. So during, I would say, the end of 2021, we received a shipment of PPE from our emergency state inventory. This consisted of gloves, masks, face shields, and we were tasked with providing these to our community partners. So if we call them providers, people that serve that help service our internal programs. So if providers were in need of PPE, they could contact us directly, and we would check our inventory to see if we could fulfill the requests. And then we would deliver the PPE directly to our providers. We weren't trying to make this a complicated process. We just wanted, the hardest thing for them to be is to reach out to us for some PPE. So once they reached out, we would then deliver whatever was requested. For the masks, we had at the time cloth, surgical, and KN95 masks. And this was very beneficial for nursing homes and different providers that went into the home of our participants. And today we are able to order COVID-19 tests in bulk. So we are tasked with providing those to community members as well. So most of our requests today are for COVID-19 tests, and we still deliver these to the different places that request them. So since we had all of this PPE on hand, we decided to host a free KN95 mask pickup event. So it was a drive-through. It was in an empty parking lot next to our building. And it was on a very cold day in January. And we had no idea that lots of people would be interested in this kind of event. So we were expecting, maybe 30 people to show up. But I walked outside about a half an hour before to set up, and there was a line down the road and around the block for people to come pick up masks. So we realized at this moment that mask accessibility is a big deal, and going forward, we were going to have these available to anyone that wanted to come in and pick them up, not just our providers. So we provided 2 packs, so that was 10 masks of adult KN95 masks for free to each person. And it was, I think what bit us in the butt was the first come, first serve while supplies last. I think that got people on their toes, wanting to be first in line to make sure that they got the masks. For each person that came through the line to pick up the masks, we would offer to order the in-home COVID test through USPS. Most people took us up on that offer, and we could get those delivered straight to their home. I'm not sure if many of you have filled that out before, but it's very simple. It's just name and address, and then if you want to track it, you can put an email address on there. So after this event, we realized that it was a hit, so we did it again in Lenawee County at a local senior center. And out of our various mask pickup events, we gave away a total of 7,720 masks, which was great for our community. And then we had masks available to pick up in the office, which we didn't track, but we had lots of people coming in to get those. I wanted to provide you all with a few stats from our vaccine hotlines. In 2021, when we first started the vaccine hotlines, we received a total of 996 calls, and those were mostly for the first dose of the COVID vaccine to get scheduled at one of those various clinics where you had to sign up online. And then from 2022 to present day, we've received a total of 172 calls, and most of these calls are for in-home vaccine requests. And then we do get a few still for transportation and a few for assistance scheduling a vaccine appointment. Still at some of the bigger pharmacies, you have to sign up online, so we do assist with that. And then since October 2021, when we started our in-home vaccines, 266 community members have received an in-home vaccine. And actually today I received an invoice for our November numbers, and 160 in-home vaccines were given in the month of November. So that number is a lot higher now. That included 3 nursing homes in Jackson County, along with individual in-home vaccines. So it's still very much needed in our community. We are the only ones at this point offering this service for in-home vaccines, and the word seems to keep spreading that this is a service that we offer. So we are getting new referrals all the time, and then we get referrals from people who had the pharmacy come out maybe last year to give them their booster. They're calling again this year to get the updated COVID vaccine. So for funding, when this first started, we received a little bit of emergency funding from our state, but for fiscal year 2022, which would be October 1st, 2021 to September 30th, 2022, we had funding from federal, state, and local agencies, and then existing contracts, which covered a budget of $110,951. And then in fiscal year 2023, we only received a small amount of state funding to continue our work, and this covered the pharmacy network subcontractor costs. Most of the expenses are staff compensation and pharmacy network subcontractor costs, along with, I didn't include on the slide, marketing. We do a lot of outreach in our newspapers, radio stations, along with newsletters. And then I believe it was around September of 2022, we did a mass postcard mailing to everyone 60 years and older in our 3 counties that had the services that we could offer for vaccine help, and along with our 3 vaccine hotlines. And then I'll talk about how we're funded now. So our Vaccines for Wellness program is still in full swing. We still have our 3 vaccine hotlines that community members contact for assistance. Again, scheduling vaccine appointments, inquiring about transportation to and from vaccine appointments, and requests for in-home vaccines. I would say the request for in-home vaccines is the biggest reason why people are calling our vaccine hotlines. But earlier this year, we received a grant from U.S. Aging to continue our work. It was for a total of $50,000, and that is how we are funding our work today. Just a little bit about the grant. It is U.S. Aging's Aging and Disability Vaccination Collaboration. We also call it ADVC. They distribute funds to organizations across the aging and disability networks to support an array of vaccination education and promotion activities, including community vaccine clinics, in-home vaccinations, transportation to vaccination sites, and outreach and education for older adults and people with disabilities. The ADVC is funded through a grant from the U.S. Administration for Community Living. So when we found out about this grant, we thought it was perfect because we were already doing all of those things, and our funding was about to run out, and it was just a great thing to find earlier this year so that we could continue our work. And since the updated COVID vaccine came out, it was great that we were able to still provide these in-home vaccines to people. The U.S. Aging hasn't mentioned that they are going to renew the funds for next year, but if you are interested in doing something like this at your place of work, I'd keep your eye out on U.S. Aging to see if they do have any announcements. We're crossing our fingers that we will be receiving funding again, but it has not been mentioned. So this year we were able to make 2 new pharmacy partnerships. I'll give them a shout out. We have Adrian Medical Pharmacy located in Lenawee County, and then County Pharmacy located in Hillsdale County. And both of these pharmacies are small, locally owned pharmacies, and the community seems to really trust going to them. So this has allowed for more vaccine clinics to be scheduled and for shortened wait times for the in-home vaccines. So previously, Brown's Advanced Care Pharmacy was doing all of the work for our 3 counties, which was a lot on them. And, you know, they're still running a full service pharmacy. So it's very nice that we were able to make these new connections and be able to have a faster wait time for these in-home vaccines. This fall, we have hosted 5 vaccine clinics. We did a drive-through clinic at our local fire department. The picture on the right there is at our local fire department. So you drive in that back door, you pull in, the person in the red giving the vaccine is our pharmacist. He will vaccinate through the window of the car. And then in front of this car is an exit door that you can drive right through. So it's probably about a total of 10 minutes to come in and get your vaccine and fill out your consent form. And then we are also able to supply incentives with this grant. So if you do get your vaccine, you get a goodie bag full of goodies to take home with you. So that's a fun part about this grant. We've hosted 2 clinics at 2 different senior centers. So Adrian Senior Center and Hillsdale Senior Center. The picture on the left is from the Hillsdale Senior Center. They were having a health fair that day, and they allowed us to come in with the pharmacy and set up shop for vaccines. One nice thing that this pharmacy did is they brought all of their vaccines that they have. So if you showed up to get your COVID vaccine, they could look you up in the state software and see what vaccines you need to get up to date on. So maybe you came for flu and they say, oh, looks like you need a shingles vaccine. They have that there with them, and you could get that as well. One thing I did forget to mention is with this grant from US Aging, they will reimburse for COVID and flu. So if a pharmacy were to give any other vaccine, we can't reimburse them for that. But if they're giving COVID, they're getting reimbursed for that. So they're more likely to bring a different vaccine with them. It seems like the hot vaccine this fall is the RSV vaccine. So we've been getting a lot of requests from that. So as long as the pharmacy is giving COVID or flu, we can also give the RSV. We hosted a clinic on site at our new building, WellWise Services. And then we had a clinic at Adrian Medical Pharmacy. They are a newer pharmacy and they're trying to get the word out. They offer delivery to the home. So it was nice having community members come in and see this locally owned pharmacy. And they were able to, take a tour of the pharmacy, see where it's located, along with getting their vaccine and their goodie bag. And then recently we are working on a partnership with our local ombudsman to educate nursing facilities on the benefit of the COVID and flu vaccines in their facilities. So we, as we speak, we have brochures being printed for the ombudsman to take with her, since she's already going to these nursing homes. She can take them with her and educate the facilities on how this is beneficial. And then if the facilities are interested, a referral will be made to us, and then we can work with the pharmacies to schedule a clinic day for the facilities. So the last thing I'm going to talk about is how to implement this in your workplace. So I think the biggest thing is to identify any gaps in service in your area among local health departments, health systems, pharmacy networks, and other human service agencies. So for us, we had those 5 main concerns, and we tried our best to find a solution to those concerns. So look for gaps, establish infrastructure internally to reduce procedural barriers, apply for grants to fund the work, We had been receiving state funds, but then we had to move on to applying for grants, and we received the grant from US Aging. So you can look there. You can look at your local community foundations or health systems. Sometimes they have a foundation where you can get grants from, and then spread funding across multiple partners. As I mentioned, we partner with the pharmacies. We're trying to partner with the ombudsman, spreading the funds so that you can reach as many community members as possible has worked very well for us. Thank you all for your time. If you have any questions on how to get started, or you just have a follow-up, you can always email me, cami.emerson@wellwiseservices.org, or you can even give me a phone call. I'll turn it over to you, Anna.
All right. Well, thank you, Cami. That was a lot of great information. And now we can have any questions that anybody might have. Is there anyone that has there are none in the question answer box, but if you raise your hand, you can be unmuted and you could ask a question. I see Brenda Jones has her hand raised.
Hi, I have a home care agency. How could we work with pharmacies?
Great question, Brenda. If you don't have someone in your area who has the US Aging grant that can help you connect with these pharmacies, you could always reach out to the pharmacies directly. Sometimes they have gifted vaccines, so vaccines that are free, and they could give those to people if they don't have insurance. Or if you're working with people who do have insurance, you could ask the pharmacy if they would be able to just come out to your site and do a clinic. Sometimes there is a fee to have pharmacists come out, but most of the time for us, if they're a local pharmacy, not like CVS or Walgreens, or they're local to your area, sometimes they'll do that on their own time and come out and vaccinate.
Okay. Well, thank you.
Thank you, Brenda, for that question. If anyone else would like to ask a question, please raise your hand and we can unmute you. In the meantime, in the question answer box, there is a question that is how much in total did this effort cost?
That's a good question. Well, fiscal year 2022, we spent about $110,000, but that was grant funded. So we were eager to spend the money. This year we have about 50,000. But for the pharmacies, for our agreed upon reimbursement rate per vaccine given, we reimburse at $33. So it just kind of depends on how many vaccines you plan on giving and what kind of agreement you come up with your pharmacy. We reimburse for mileage. You wouldn't have to do that, but we offer that to our pharmacies. And then we also reimburse for drive time, and that's different for each pharmacy. It's usually around $33 per hour driven. So it just kind of depends on what, how many vaccines you're going to give, what you're looking to do. We worked on a very small amount of money at the beginning of the last fiscal year with our state funds. And then usually our busiest times are between September and about February. So from spring and summer, we're not doing much work on this. We get a few in-home vaccine requests here and there, but you can really focus your time and money on those September through February months. But I don't have a total from the time that we started till now on how much we've spent.
Okay, thanks, Cami. Any other questions that you'd like to raise your hand or type into the question answer chat box there? While we wait, I'd ask a question about the local ombudsman. You talked about how they will educate nursing facilities on the benefits of the COVID and flu vaccine for staff and residents. Can you expand a little bit on that? Will those be conducted in person or virtually? And, is there a plan to try to generate interest in that in nursing facilities?
Yeah, so it will be done in person. The ombudsman spends a lot of time in nursing facilities anyway. So we thought it would be a great person that already has a relationship with these facilities and knows the staff there. So she'll go into the facility with the brochure. In the brochure, it lists all of the different vaccines, when they should be given. If it's a yearly thing like the flu, or if it's shingles where it has 2 doses. So it discusses all of the different vaccines, and then it discusses how giving these vaccines in the homes can help reduce, trying to think of the word, infection throughout the whole facility. So we're hoping that just by spreading the word that we're here and we're here to help, and if they do want to vaccinate their facility, they can reach out to us. Then we can coordinate with pharmacies to do that. Did that answer your question, Anna?
Yeah, I think that's and it's such a great opportunity to engage with your local ombudsman as well.
Mm-hmm.
I see that there's another hand raised. Brenda, do you want to ask a question?
Yes, I wanted to know, is there maybe a vendor that I could use maybe in terms to buy PPE? PPE, I'm sorry.
That's okay. Where are you located?
Connecticut,
Connecticut.
New Milford.
I'd have to look into that for you. I'm not familiar with Connecticut. For us, our state sent us the PPE. So we didn't do any ordering of it. So
Okay.
I don't have a good recommendation for you. But I could, if you put your information in the chat, I could get back with you.
Sure. Thank you.
Thank you, Brenda, and thank you, Cammie. Are there any other questions? Well, we're getting close to the top of the hour, and I would just like to thank Cammie for joining us today. I think there was a lot of really great information that was presented, and the importance of vaccine and in our whole wellness. And I think you did an excellent job in explaining, vaccine for wellness. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov. Again, thank you for joining today's webinar, and our session is now concluded.